Hello, friends and foundation of the Public Library of Monroe County. My name is Megan Deschateauvieux, the president and CEO of Willow Domestic Violence Center. And this is my book review video of No Visible Bruises, What We Don't Know About Domestic Violence Can Kill Us by Louise Schneider. I really wish that I could be there in person with everyone. This is a little strange to be recording a review when I was hoping to be able to have a discussion and conversation about this really critical issue and this really important book, which I read a few months ago, back in November, on the train to Albany as I was headed to the governor's task force on domestic violence. We're charged with reimagining what services could look like in our state and in our community, and drawing on a lot of the success of Monroe County and the way that we respond to domestic violence. So I read this book cover to cover in the 8 hours back and forth on the train, and I filled it, as you can see, with post-it notes and underlines, and I wrote all over it. I made a lot of notes, and I thought it's just an incredible piece of work. With Louise Schneider is a really impressive journalist, and she tells us these stories in a way that really brings them to life and helps to illustrate the complexities and the nuances of domestic violence and the ways that we as a community can enhance our responses to this issue. So I did have a PowerPoint to share and had hoped for a conversation, but I have my notes and I'd like to kind of share what my thoughts were about this book with you. This is something that should be required reading for every college class. It's a basic DV 101 or DV 201, where it gets into a little bit more in depth into the complexities of domestic violence and what works across the country, what is showing some positive results in terms of how this is impacting people's lives, and that we're able to actually reduce the number of people impacted by this and the number of fatalities in a community with strategies that Rachel kind of delineates in the book. It includes dates, policies, key people. It's a historical analysis of the movement and the change in public perception, the shift in the landscape, the way that people are responding to domestic violence and survivors has changed dramatically in the years that she's covering in this book. And it's amazing to see, in my lifetime, that this has been such an incredible change, nearly 40. And 40 years ago, these systems and supports that are in place right now were not there for survivors in the past, and we still have a long way to go in making sure that the system fully supports everyone. So the book is a fatality review. It is a forensic analysis of lives lost to DV, and one in particular, the story of Michelle Munson-Mosier and her children, Kyle and Christy, who the family was murdered by Michelle's husband, Rocky, the father of Christy and Kyle. And this is not a spoiler alert, you know this in the very beginning, in the first couple of pages, this becomes clear that this is what happened. And so the rest of the book is kind of an unfolding of the story and digging back into the pieces that led them to this place of this tragedy, and trying to discern what we as a community, as a society, could have done differently to really analyze this and think about how we can move forward with other cases. What are the red flags that we might be missing? What can we pick up from this story and learn from this tragedy to be able to prevent it happening ever again? So we know that this is very real in our community. We had last year 10 homicides that were domestic violence related in Monroe County, and that number was higher than most years, but we do see between 4, 6, 8 homicides each year, and those are the numbers that make the news. Those are the numbers that people know about, that we read about in the paper, and there are thousands more that we are able to support and lift and help them turn their lives around and help them escape and find a safer, brighter future for themselves and their children. and their pets. And so we have put into place some of these strategies that this book outlines in our community, and we could argue in some ways, many ways, that these are working, and that there still obviously remains work to be done to prevent further tragedies. So in Monroe County, we release a domestic violence report each year that shows the trends and the stats in the community. This is the report available on Willow's website from 2018, and it shows that it impacts everyone. So domestic violence has no boundaries. We see nearly half and half, city and suburban. We know there are nearly 50,000 calls to 911 that are classified as domestic disputes, and then the trends are just increasing. You can see this this chart showing the rates of domestic violence in Monroe County and the rates in Rochester, and they are much higher than the statewide rates, excluding New York City. So we have a significant issue in our community, and we are working collaboratively in every way we can to address it. This piece of the report shows our community response. And this is also available on our website, willowcenterny.org. We'll release the next one this October for 2019. So you can see the orders of protection, probation, law enforcement, the courts, Willow with our services for survivors, and other agencies all work together to support survivors and to hold victims or to hold offenders accountable. The strategies that Rachel Louise Schneider presents in her book are many, and as I was reading it, it was validating to see that we are doing a lot of this and have been doing a lot of this work in Monroe County for a long time, with the Domestic Violence Consortium being in existence for over 20 years. Willow Center has been here for 40 years, and we do provide these critical life-saving supports to people. As I'm reading it, these ways that she's saying reduce fatalities and improve and save lives, I was nodding and checking all these boxes in my head. So she talks about partnerships with police. Yes, we do that. We have incredible partnerships with law enforcement, and they are very supportive of what we do. Probation, yes, we do that. Courts, yes, we are there in the Hall of Justice. Custody and visitation, yes, we are partnering with SPCC, the Society for the Protection and Care of Children, to ensure that the families are taken care of, that we know children can be supported through this process. CPS and Bavona partnerships, the same sort of issues where we see domestic violence impact families on multiple levels, and often children are the youngest victims, and they witness domestic violence in the home. That trauma can carry with them for life. And so what we do to reduce that impact of that trauma, to build resiliency in young people, and to work with our partners to make sure that we're taking care of the children. We have advocates in our local hospitals. The HEAL Collaborative at URMC is an incredible program where our advocates are there in the emergency room. They can be dispatched to respond to a call and provide a support on site, and then also remote filing of orders of protection to the court program, so they can Skype with the judge, have the order granted, and know that they're safe leaving the hospital. We do prevention in the schools, and we increase our reach with mobile advocates. We have hybrid positions, we call them, of people who are out there in the community doing prevention and workshops, and also being there for outreach and support to survivors when they have a disclosure. We are also doing public marketing campaigns. I don't know if you've seen billboards and buses and media outreach. We have had incredible support from the Truth Collective, from our partners at Truth Collective, to build this outreach campaign to be able to kind of shift the landscape and change people's minds about domestic violence. So this was validating that our community is still remains at the forefront of domestic violence services and response, and we have this coordinated effort with so many players that come together to really support survivors and work really hard to make sure that communication stays open and that we provide that feedback and work together to address the issue. We are trying to change minds and hearts to move the needle on this issue in our county, and yet we know that there are high rates. We have numbers rising in the chart that I just shared, and we see fatalities. So we can say that the numbers rising are due to more awareness, that people know that domestic violence is happening in the community, that people are more comfortable reaching out for services, that our marketing campaigns are working. And people say, yes, I understand Willow's there for me and I can call them anytime. And that's my optimistic view. It could be that cases are increasing and something is happening in the community where we're just seeing more and more domestic violence. And if that's the case, then we have an incredible responsibility and obligation to address that in the best way we can. So this book is gut-wrenching. It is really emotionally difficult, a bit to get through. So I found myself, as I was reading on the train to Albany, I put it down a couple times. I read a couple pages and then I wrote a couple notes and then I sat with it. And I just looked out the window and tried to absorb what I had just read, because she probes these intimacies of family dynamics, of childhood trauma and pain and relationships and the toxic friendships, emotional and psychological abuse. She looks with a very clear lens on these issues, and within this family, kind of cataloging them and then inviting us to imagine the daily lived experience of a survivor and their children in this context of a community where there were supports available and some people sort of knew something was going on, but no one really felt comfortable breaking into this private family affair and doing anything, helping her in any way that was substantial and sustainable. So there are these moments, as I said, of intense emotion. There's one in particular of the grandmother in the grocery line and just the shared humanity of people realizing who she is after they hear about the murders. And as she very publicly grieves her daughter and her grandchildren, it's hard to read. And yet those are the moments that really galvanize us to say, this can't happen again. And there's too much pain and too much suffering rippling out from these tragedies that are senseless and preventable, because we know that domestic violence is preventable. So I will never forget these vignettes, these little glimpses into a life that she shares, and that motivates me to continue to do this work 24/7. We know this family, like we know these faces, we know these people, we feel what they're feeling, and she really gets it's almost like a fiction novel in that you really start to understand the people and the players and the complexities and dive into their experience, and then to understand the greater picture, right, both micro and macro, of the society around them and how the system both supported and failed them in different ways. So I draw a line right to the families that I have known and that we have lost here in Rochester. It's very real and vivid. And yet it's not doing any good to dwell in the sadness and the trauma. And we have to find light to draw strength and let this fuel our commitment to ending domestic violence. So Schneider encourages the reader to dig deeper and to draw these parallels between this experience of this family and what is happening on a bigger level, to consider the tragedy with a lens of forensic analysis, to find these patterns, to make connections, to identify the ways the system failed and how we can and we must do better. And we can draw parallels with all of that to what's happening in our community. So we talk about the front lines of any battle. We have our nurses and doctors right now on the front lines of the coronavirus response, doing an incredible job saving lives and defeating this invisible enemy. And at the front lines of domestic violence, we have two primary forces. There are the DV advocates, Willow and our partners in this work, service providers who are on the front line supporting survivors, sitting with them through court, talking with them on the phone in the middle of the night, really being by their side. And then we have law enforcement, who is there as a support to protect survivors and to hold offenders accountable. So they also have the middle of the night calls, and they're responding to the home and being with survivors and supporting them in their time of need. So we know that this partnership is really important. And Schneider shows us that across America, the communities that had either lowered their fatality rate or increased their access to services had that one thing in common, that there was a really strong collaboration between DV advocates and police departments. So we have this partnership. I would like in particular to think about and lift and celebrate the work of the Greece Police Department. Chief Fallon is an incredible partner, and he will do a monthly audit of the domestic violence incidents and the calls that officers are responding to. And if he sees that there is a domestic violence incident call and not a corresponding report filed, then he'll call the officer in and ask why. What happened? Was this an erroneous 911 categorization? Was this a situation that you felt could be resolved in a different way, but why and how? And should a DV report have been filed? And so those questions that he's asking and the exploration he's doing with his team of officers is really helping to change the way that the law enforcement is responding to survivors in that community in Greece. So we're really excited about that. We're also able to provide feedback with law enforcement regularly about what survivors tell us they're experiencing, and then we can share that with the chiefs who then talk with our officers about it. So this relationship continues to grow and to change the way that survivors are impacted in the community and the way that law enforcement responds. So this will change lives. This will save lives, the way that we can work together even more strongly. So Willow is here for the victims and the survivors, and law enforcement, along with probation, the courts, many other partners focus on the offender accountability. Both sides are critically important, and we see that in this book, where Schneider spends some time visiting with the abusers. She visits the jails, she talks with abusers, she talks with the abuser's family, and she tries to understand their story, why they made that choice to be abusive and to be violent, to murder their loved ones. And she finds what we already know, which is that hurt people. And there's a lot of research and literature about this. Childhood traumas and scars run deep, and they sustain the cycle of abuse. And this is not an excuse, but it does help us to further understand the importance of ending violence in the home, that we have a duty to break the cycle, to raise the next generation to break the cycle, and to create and sustain healthy relationships, and to show what healthy relationships look like. So we have prevention programs in the schools. Schneider talks about the importance of that prevention, being able to break that cycle and really talk to young people about what a healthy relationship looks like, what the red flags are of a dangerous relationship. She also talks about advocates being on the front lines, having the tools to respond and then to follow through. So for all of us, when a survivor shows up, when they speak to a school counselor or a teacher or a hairstylist or a bank teller or anyone, a pharmacist, a doctor, a coach, anyone in the community that people feel comfortable talking to and disclosing to, sharing their story with. Perhaps they're asking for help, perhaps they just want someone to listen. And it's important to know how to recognize that the signs of abuse, how to respond in an appropriate and compassionate and effective way, and how to refer someone to services that they might take advantage of and might benefit from. It's up to all of us to know how to do this. So Schneider says that, and this is a direct quote, and this was really powerful for me to read and to understand a little bit more about what, if you're not familiar with domestic violence, if you don't know about the complexities, if you've never really studied it or engaged in this work, or talked with survivors in a direct level, or looked at the research, this is really important coming from Schneider, who did that, who was outside of this issue and then dove right in and tried to understand everything she could about it and share this with us in this book. She writes, "Domestic violence is like no other crime. It does not happen in a vacuum. It does not happen because someone is in the wrong place at the wrong time. Our homes and families are supposed to be sacred territory. This is part of what makes it so untenable. It's violence from someone you know, from someone who claims to love you. It is most often hidden, and on many occasions the physical violence is far less damaging than the emotional and verbal violence. And this is something that we see often, the psychological abuse. Those wounds and those scars go deeper even than the physical abuse. And many times a survivor does not even need to be in a relationship where there's physical abuse for there to be an incredible amount of control and manipulation and terror in that home by psychological abuse alone. And this is part of the story that she shares in this book as well, of Rocky and Michelle. And he barely laid a hand on her, and was able to maintain absolute power and control in that home because of the psychological abuse. And that's really important as we think about how we protect and support survivors in our community, how we respond, and the way that we think about abuse as a broader spectrum, as many different types of abuse, and that it doesn't necessarily follow the same pattern for every survivor. Everyone's journey is unique, and the psychological scars can be significant, perhaps even more so than physical for some survivors. And there are many in our community who are trapped in this relationship. I wanted to share another quote that I think is really important about these survivors who are, as I said, trapped in the relationships and in their homes and not feeling safe in their homes. And this quote, I think, is so important for everyone to understand. And it's a reflection on the character and choices of many survivors, as we might sit in a place of judgment and think, why don't they just leave? I hear that question all the time, and it's enticing. Of course we want to ask that. Why don't they just leave? Why can't they up and leave if this is not a safe environment for them to be in, for their children? And so this explains it more succinctly than anything I've ever read. Women like Michelle, the woman whose story this is focused on, women like Michelle share this steadfastness, determination, and resoluteness to keep themselves and their children alive by any means possible. They don't quit. They stay in abusive marriages because they understand something that most of us do not. Something from inside out, something that seems to defy logic. As dangerous as it is in their homes, it is almost always far more dangerous to leave. Many of them plan like Michelle did. They stay. They bide their time. They keep their children safe. They balance, poised on the front lines, hypervigilant and patient, in a constant scan for when they can slip away intact. They do it for as long as they possibly can. This is sustained long-term trauma, and it is why we see so much PTSD in survivors. It is why we see people stay in relationships that we might think, why don't they leave? It is why this is so hard for people to break away, to escape from a dangerous relationship, and to find that safety and support they need. It's why safety planning is so critically important, and why we have these creative and innovative and survivor-centered responses, so we can meet people where they are, wherever they are in the community and in their journey, their stage of readiness, so that they feel comfortable coming forward and ready for the supports and services that we can offer. Because even when someone leaves an abusive relationship, they may find safety in our shelter. Average stay is 30 days. They find safety there. They find support through the counseling center. They might have an order of protection. We might be able to change the locks in their house. But the long-term impact of what they've experienced will really last for decades, and is something that needs to be addressed in more significant ways. So we have a great crisis response, and we have incredible tools for building resiliency and supporting people through that process. But it takes the entire community to wrap around and come together and take care of each other and look out for people, because once people leave that crisis response, they leave our shelter, the abuser leaves jail if they were imprisoned for their crimes, and then what? And then how do we continue to keep survivors safe? And I think that is one of the reasons why many survivors don't leave, is because of that uncertainty of the long-term future. So the survivor is the expert in their own life, and we as a community have this responsibility to be ready to support and protect them, and to ensure that our system is here, that no one falls through the cracks, that we recognize everyone has the right to be safe. Everyone deserves to be safe. So I found this book invigorating and exhausting, And to be honest, it was emotionally a roller coaster with these really dark truths that resonated on a deep level, and then these moments of incredible hope and light. I had to reflect on the immensity of what she was sharing, the stories she was telling, and the lives that really are impacted by domestic violence, and this ripple effect that goes beyond the immediate family, the immediate survivor. We are planning on bringing Rachel Louise Schneider to Rochester sometime this year. We had booked her for our May spring luncheon, which we have postponed to a later date, TBD, to see when this all kind of blows over. It is my hope that we will all emerge from this pandemic, from this stay home recommendation, safe and healthy, and even more connected and compassionate with each other. We know there are survivors in their homes right now where a stay-at-home order is actually more dangerous for them perhaps than being outside. And so lifting the supports that are available for them at this time is critically important. Willow remains open during this pandemic. We are an essential service with our hotline and our shelter still available for survivors, and we will continue that crisis support and counseling support and long-term support for as long as we need to. I really wish we could have a Q&A. I would love to have a conversation after this, and I welcome the chance to have an in-person discussion when we emerge from this COVID crisis. I hope you will all stay safe and healthy and well, and I thank you for tuning in to my report on this incredible book. And I do recommend it for everyone, and I recommend it particularly for those who are thinking of going into the field, or for those who have someone in their lives that is experiencing domestic violence. For anyone who is seeking safety and support, Willow's 24/7 hotline is 222-SAFE. That's 585-222-7233. And we have a text line that is 585-348-7233, 348-7233. And our website, of course, is willowcenterny.org. Okay, thank you.